I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, don't forget to subscribe my channel. Now this patient, you can see that there is some pathology on the cornea. It was 80 years old female patient who was brought to me by her children, and it was an interesting case because she was misdiagnosed as a case of a keratitis, and she was even given a corneal ulcer treatment, but the condition was not improving. When she visited me and I examined her, the cornea was all right, but the anterior chamber details were hazy, and her vision was PL positive. She was only able to appreciate the light, and when I recorded her intraocular pressure, it was 45 millimeter of mercury. There was a diffuse corneal edema, and anterior chamber was filled with white, fluffy material. She was in a severe agony. She was having nausea, vomiting for the last 2 days. So, I diagnosed her as a case of phacolytic glaucoma, and I would like to thank Siddhant Bamke from India, who is a regular watcher of my YouTube channel, and he correctly diagnosed her as a case of phacolytic glaucoma. So, later on, when I controlled her intraocular pressure, I performed her surgery. I have a complete video of the surgery. Here I am just showing you glimpses of the surgery, that when you enter into the anterior chamber and perform irrigation aspiration, all the anterior lens matter which has escaped the capsule can be removed. So it's a very important lens induced glaucoma, phacolytic glaucoma, and it is also a type of secondary upper angle glaucoma in which the lens slowly and gradually becomes mature, then hyper mature, and a stage comes when it is unable to contain its continuously producing proteins, and proteins are leaked through intact capsule. The released material is composed of altered lens protein, macrophages, and other inflammatory cells that lead to blockage of aquaspores in the trabecular meshwork and precipitates glaucoma. Now, intraocular pressure in this condition is very high, and the patient presents with severe pain, periorbital headache, watering, photophobia, red eye due to hyperemic conjunctiva, and a severely decreased vision. Usually, phacolytic glaucoma occurs in very old, frail patients that had a gradual decrease of vision due to maturation of cataract, and they are often very poor or neglected patients because usually affording patients they seek doctors care before reaching this advanced stage of disease. So when I received her, I started her on topical anti-glaucoma, aqueous-suppressant drops, cycloplegics, and topical steroids. And I also give her oral acetazolamide and painkillers. And I assured them that the pain will subside within few hours, and when the IOP comes down, typically in the 20s, mid 20s, then under the cover of IV mannitol, we will proceed for surgery. So I gave her medication for a few days, and then I proceeded. When they came back after a few days and I checked, intraocular pressure was 25 26. Then I proceeded with the surgery. I made complete video of the surgery, and in the next video I will show you how to perform phacoemulsification of a phacolytic glaucoma. It's a very rare but important lens induced glaucoma, and I thought I should not only share phacolytic glaucoma in detail but also show you the phacolytic glaucoma surgery. Thank you very much.